and welcome to my clinic. I'm Dr. Aldrich, your online informed consent doctor. Today we'll discuss the benefits and potential risks of this medical decision you're about to make. Feel free to stop me anytime in this conversation by clicking the stop button. You can also ask me to repeat something I've said by clicking the rewind button, or speed up on something you already know. Appendectomy. Your doctor has offered you an appendectomy, and you're wondering if you should do it. An appendectomy is a surgical operation to remove the appendix. The appendix is a small pouch-like organ located in the lower right area of your tummy. This procedure has been offered because a diagnosis of appendicitis was made, meaning that your doctor believes that your appendix is inflamed or infected. The goal of appendectomy. The primary goal of the appendectomy is to alleviate the symptoms and complications associated with having an inflamed or infected appendix. Before the procedure begins, you will be given medication to put you to sleep. There are two possible ways the procedure can be done, known as laparoscopic and open appendectomy. The laparoscopic appendectomy involves 1 to 3 tiny cuts which are made on your tummy. A long thin tube, called a laparoscope, is put into one of the cuts. This tube has a tiny video camera and surgical tools attached. The surgeon looks at a TV monitor to see inside your tummy and guides the tools to perform the surgery. And the appendix is removed through one of the incisions. In the second type of appendectomy, which is the open appendectomy, a cut or incision that is about 2 to 4 inches long is made in the lower right-hand side of your tummy. And the appendix is taken out through this incision. The choice of the surgical technique will depend on the surgeon's assessment of your case. Note that your provider may convert a laparoscopic appendectomy to an open one during the procedure. For either type of surgery, the scar is often hard to see once it has healed. Possible risks and complications. The appendectomy is a fairly common and generally safe procedure, but like any other surgery, it carries certain risks and potential complications during and after the surgery. As with any surgery, you could react to the sleeping medications that were given or any other medications given during the procedure. Cut sites could bleed more than what is expected or can be controlled. A nearby organ can be mistakenly cut or tied. After the procedure, the cut site could get infected, and pus could collect behind it. This infection could spread to surrounding structures like the bowels and blood. And this surgical site might not heal as quickly as it should because of the infection, and when it eventually does, it might leave a scar you don't like. Another feared complication is the formation of blood clots in deep veins of the leg. Now you're wondering what clots have got to do with appendicitis. There is an increased risk of clot formation in patients who have been hospitalized, also the surgery, especially surgery in the tummy, and most importantly, when the case of appendicitis has become complicated or infected. All these would increase the risk of blood clots forming in the deep veins of the leg. Now when these clots form in the leg, they can travel from the leg to the chest and block a major blood vessel in the chest. That said, failure to have the surgery when needed could worsen the appendicitis, increasing the risks of complication, infection, or perforation, and the infection might spread to other organs in your tummy, and you don't want that. Now that you know the benefits and risks of this medical decision, I think you're now fully informed to make your choices. Choose wisely, because you alone will leave and live with the consequences of your choice. The choice is yours. If you have any questions for me, you can ask by dropping them in the comment section. And if you would like to visit this clinic again, click on the subscribe and notification button. Unlike your other doctors, I work for you and not your insurance company, so you can trust that everything I've told you is true. Please click the like button to encourage me to continue to do this.